If you're considering surgery for a meniscus tear, make sure you watch this video before you make any decisions. Hi everybody, my name is Will Harlow and I'm the Over-Fifties specialist physio here at HT Physio in Farnham. And today I'm going to be talking about the dangers of meniscus surgery. Now before we dive into the content of the video, if you haven't already, please hit like on the video and subscribe to the channel, because then you'll be the first to hear about our new videos when they come out. Now that that's been said, let's talk about meniscus injuries and meniscus surgery. So when we're talking about the meniscus, what we're talking about is a structure that exists within our knees. It is a layer of what we call fibrocartilage, which sits between the two bones of the knee, the femur and the tibia. So it sits between your thigh and your shin bone. And this is the meniscus here. You can see it in the diagram. There's two parts to it. You've got the lateral meniscus on the outside and you've got the medial meniscus on the inside. So it sits there like what we call a shock absorber. And that's exactly what it does. It cushions the blow when we walk on the ground and when we run from the shin up to the thigh, and it stops any excess wear and tear on the knee. And it's a very effective structure at doing that. Now, the problem with the meniscus is it's very tightly attached to the top of the shin bone, which means that it doesn't like twisting. Now, I don't know about you, but when I go about my day, I'm often twisting on my knees. Probably most of the time I'm rushing around from place to place and my foot's planted and I'm twisting. And most of the time my knee's quite happy. But from time to time, that twisting stress might just be enough to cause a meniscus injury. And that tends to be more and more likely with age. People who have a meniscus injury tend to report either a slow onset or a sudden onset of knee pain right over the joint line. It can really hurt to twist. It can cause swelling. It can cause tenderness when you press on it. It can cause giving way. And in severe cases, it can cause locking where the knee gets stuck and it can't move. Now, once upon a time, back in the 1980s and the 1990s, if someone went to their doctor with a meniscus injury and the doctor assessed it and said, yeah, I think you've torn your meniscus, the cure for this is quite simple. We're going to send you straight through to an orthopedic surgeon who's going to operate on your knee. Now, the first iterations of this surgery were that the surgeon would actually just remove the entire meniscus, okay? And then the second iterations of this surgery were that the surgeon would just trim away a part of the meniscus tear. Now, when the surgeons did these surgeries, people would come out the other side, and sometimes it would be like a miraculous cure. They would feel like their knee was totally better. The pain was gone, the locking would stop, the giving way wouldn't happen as much, and the person wouldn't even need that much physiotherapy afterwards because their knee would still be quite strong. So once upon a time, we thought that this is the cure for a meniscus problem. Everyone who has one needs surgery. Now let's fast forward a few years. And what we found was that the people who had the meniscus surgery all those years ago were the same people we were seeing 5 or 10 years later with more severe knee arthritis than the rest of the population. So what it turns out is that the meniscus surgery was leading to an acceleration of knee arthritis later in life. So a lot of the people who had knee meniscus surgery go on to have later on knee replacements because the arthritis sets in a lot quicker. And the reason this happens is because the surgeon has messed around with the shock absorber, so you're not getting as much cushioning up through the limb, which means that the normal cartilage within the knee is being worn down quicker. So we learned that the hard way, and a lot of patients learned the hard way that with the knee, even if it's taking a long time to get better, sometimes the best option is still not to operate. So the dangers of meniscus surgery, the main danger of meniscus surgery is this early onset of arthritis later in life. Now, the problem with meniscus injuries is for anyone who's had one, they know that it takes such a long time to get better. It's easy to assume that it's just never going to go away. I've met people in the clinic who've had a meniscus injury for 9 months and it's still giving them a lot of bother. And they quite rightly ask, will this ever go away, or am I just stuck with this forever? Now, the answer is they do usually tend to heal, but they just take a very long time. So the things you can do to speed them up include maximizing the flexibility of the muscles in the leg around the knee, improving the strength of the quads and the glutes, definitely, improving the mobility of the knee joint itself, so you're bending and you're straightening it better as well. And then getting treatment from a qualified professional can also help to speed up the process somewhat as well. Now, there are some cases still where meniscus surgery is a good idea. And those cases tend to be when the meniscus injury is causing the knee to lock. Because when you've got something called mechanical locking, which is when the knee gets stuck, usually it gets stuck when it's straight, there isn't that much you can do about it to free it up, and it can be very debilitating. It also doesn't tend to just go away on its own. So for those people, an exception is still made. Surgeons will still be happy to operate on people who have mechanical locking in their knee. But nowadays, the modern surgeon has moved away from meniscus surgeries because it's such an important structure. You still need it. We can't function very well when bits of it have been taken away. And you have to be very lucky indeed not to experience worse arthritis later in life after you've had your meniscus removed. So I hope that answers the question as to the dangers of meniscus surgery. It's definitely something to consider. My goal here is to try and educate people about things like this so they can make an informed decision about their care. So if we've done that today, please leave a comment below and just let us know that you found this video useful. And if you want to get more from me, you can pick up a copy of my book with tons more info and tips like this one. It's called Thriving Beyond 50, and you can find it on Amazon using the link below this video. Anyway, that's all I had to say for you today. Hope you've enjoyed the video, and I look forward to speaking to you on the next one.